Hi, I'm Dr. David Magnano. I'm a Clearwater chiropractor. I'm licensed in the state of Florida and New York, and I currently practice in Clearwater, Florida on Gulf to Bay. I'm here to talk to you about headaches today. Now, headaches are a very common problem, but when somebody has headaches, it's not normal. It's not a sign that everything's all right, and they just need to take some aspirin or some pain medication or things of that nature. Any symptom in the body is a sign that something's not working as it should. And the real way to fix it is to find out what's causing the problem and then correct that cause. Sometimes it's as simple as just drinking some water or salt or potassium, especially here in Florida when people perspire a lot. But what I have seen, regardless of the type of headache or the severity of the pain, is that the most common cause of a headache is a condition called a subluxation. Now that's a fancy word, and I use it in relationship to the spine. It basically means that one of the spinal bones has shifted out of position enough to put pressure on the spinal nerve root, and then that can cause headaches. It can cause headaches in the back, almost like the stress or tension headache. It can cause headaches in the front. It can even cause the sinuses to become inflamed and a sinus headache. It can even cause some of the most severe migraine headaches possible. Now what I want to show you here is I have a spine, I have a model of a spine here, and you can see the spinal bones. Each one is separated by a disc. And then there's a nerve root that comes out. And this nerve root will travel to certain areas and parts of the body. What happens sometimes is the spinal bone will get shifted or twisted out of position. That puts pressure on the nerve, causing that part of the body to get sick or become diseased or start to die a little bit, and it always produces a symptom, sort of like headaches. Now if you look here at this chart, you'll see these yellow nerves coming out between the gray spinal bones, and we see on this chart here there's buttons, and each button represents one of the 24 spinal segments. If we put pressure on a nerve here, you can see the area where it's traveling and where somebody would get maybe the frontal headaches or over the eyes or the side by the temples. If we put pressure here, you can see this area here towards the back and neck and towards the back of the head. That area would be the area that the person would have the headache. Now what I've seen in my over 28 years of practice, and we've treated something like 15,000 plus patients, is there's usually a problem, well really, probably 95-98% of the time. Some people are worried that, they have a tumor, their headache is so severe, and we generally don't see that. But we do a nerve test in our office to find out exactly what the cause of the problem is. But as I was saying, and probably 95, at least 9 out of 10 times, the cause of the problem is a shifting of the spinal bones. Now, a lot of patients will ask me that have headaches, geez, I have such tightness in these muscles, such tension. Well, as soon as a bone shifts out of position, the body's protective mechanism is to try to clamp down on that area so no more damage is done to the nervous system, because the nervous system is the system that controls and coordinates all the functions in the body. So the body will work to protect that. It'll clamp down on those muscles. That can cause a lot of tension in the neck muscles or in the shoulder area. That's again a sign that a spinal bone has been shifted out of position, putting pressure on the nerve. Now, for anybody out there that has headaches, if you want to get tested, you can call my office and you will be able to come in for a nerve test. We will run the test at no charge. We do this as an educational tool to try to find out what's causing your problem, and then if my treatment will help. If we ever find another cause of the problem, we'll always refer you out to somebody that will be able to help you. But to just cover the headaches up with medication, whether it be aspirin or some other type of medication, is really not getting to the cause of the problem. And generally, when you cover something up over a period of time, it will become worse and then generally cause more problems in the future. Once again, my name is Dr. David Magnano. Thanks for listening.